Key points. Massive Medicaid cuts proposed. The GOP budget blueprint aims to achieve nearly $2 trillion in federal savings, largely by targeting the Department of Health and Human Services and, by extension, deep cuts to Medicaid, medical assistance in Minnesota. Impact on low-income Minnesotans. Over 1.4 million low-income Minnesotans, representing roughly 25% of the state's population, rely on Medicaid, meaning drastic cuts could severely affect their access to care. Strained state budget. The proposed cuts could force Minnesota to cover an additional $1 billion a year, worsening an already projected budget deficit. Threat to community health centers. Hospitals and community health centers, many of which depend on Medicaid revenue, warn that deep cuts would disrupt essential services, particularly in rural areas. Wider social safety net at risk. Besides Medicaid, other programs like Pell Grants and food stamps could also face reductions, while massive tax cuts for corporations and high-income earners remain in place. Political leverage for Democrats. Democrats have seized on the potential Medicaid cuts as a political weapon heading into midterm elections, criticizing the plan for favoring wealthy donors at the expense of working families. Warning from within GOP. Influential Republicans, including former Trump advisor Steve Bannon and several state lawmakers, have expressed concerns that cutting Medicaid could backfire, given its role in supporting a significant portion of the electorate.